Hello, I am Shine Enriquez, and for today's video, I'll be performing health history taking with my patient. So before the proper procedure, make sure to perform hand hygiene to prevent cross-contamination. Good morning, ma'am. I am Shine Enriquez, and I'm a first-year nursing student. And you are?
I am Retdem.
Alright, and how would you like me to call you?
Just call me Leslie.
Okay, Leslie, before we proceed, I need you to verify some of your personal information here. Your complete name, please,
Leslie Templanda,
and your age.
49 years old.
Is this your address?
Yes.
Okay, and are you married?
Yes, I'm happily married with 2 kids.
Okay, so before getting any further, I'd like to let you know that in order for me to help you today, I need to ask you some questions, particularly about your health, medical background, and some of your personal circumstance. Will that be okay with you?
Yes, it's alright.
Okay, and your answers will be documented so that we will be able to formulate the best care plan that will suit your needs. Do you have any questions?
No.
So let's get started. So what brings you here today in the hospital, Leslie?
Well, I came here today because I'm having a problem with my severe coughing.
Okay, so when did this started?
I suppose it has been 4 days already.
Okay, and have you got any symptoms along with this cough?
Yeah, I had a very bad sore throat and it's very itchy.
And this sore throat, has it been there the same amount of time as the cough?
Yes.
Okay, and does your cough and sore throat get worse at any particular time of the day or night?
It's usually very disturbing every time I'm going to sleep.
Okay, and about your sore throat, are you able to swallow with it?
Yeah, I can swallow, but there's like a pain every time I swallow some solid food.
Okay, and can you drink?
Yes, I have no problem with liquid.
Okay, so about the cough, can you describe it for me?
Well, every time I cough, I've noticed that there is a presence of phlegm which is yellowish in color and it is very sticky.
Alright, so is there any tinge of blood in the sputum?
I haven't noticed any.
Alright, so on a scale of 1 to 10, 10 being the worst and 1 being the least, how bad is your cough?
I suppose 7 to 8.
Okay. And do you feel any pain around your neck or chest or anywhere else in your body?
Yeah, there is a pain in my throat every time I cough. And actually, I'd also slight difficulty in breathing every time I cough also.
Okay, and can you point exactly where the pain is?
Every time I cough, I feel a pain in my chest and also here in my throat.
Okay, so the pain is in the middle of your chest and also here in your throat. So does this pain radiate in your body
No.
or anywhere else?
No.
Okay, so it's pretty localized. And can you describe the pain? Is it like throbbing, stabbing, or squeezing, perhaps, or anything?
Well, it's like squeezing.
Okay, so on the scale of 1 to 10, 10 being the worst and 1 being the least, how bad is the pain that you feel?
Since it's variable pain, so it's just 3 to 4.
So have you taken any meds to alleviate the pain, the sore throat, or the cough?
Yeah, 2 days ago I bought carbocysteine. It was 500 milligrams. I also bought some strepsils along with it to relieve my sore throat.
Okay, so how many days have you been taking the medicine?
I think it's already 2 days.
Okay, and have you ever been admitted to the hospital before for any health illnesses?
No, I haven't been admitted to the hospital before.
Okay, so you don't have any other illnesses like diabetes, heart problems, or asthma like that?
No.
Okay, and I suppose you also don't have any maintenance medications?
No.
Alright, and how about allergies? Are you allergic to anything like foods or pets?
I have allergies on peanuts and I got some reactions every time I eat shrimps. I also noticed that every time I play with my dog, I always sneeze.
Okay, and do you know if you have any drug allergies?
I think not.
Okay, so you've mentioned that you're married. Do you have any children?
Yes, I have 2 kids.
Okay, so how old are they?
My eldest is 23 years old and my youngest is 18 years old.
Alright, and are you still having your menstrual period?
No.
Okay, and have you experienced any miscarriages?
No.
So, do you have any reproductive problems?
Well, I only have menstrual cramps at the time. At the time, I still have my period.
Okay, so let's now proceed to family history. I'd like to elicit some information about your family health background. Is that okay with you?
Yeah, it's okay.
Okay, so do you know if there is any of your first degree relatives, like your mom, your dad, and your siblings, ever suffered from any jaundice?
No.
Okay, how about anemia?
No.
Asthma?
Well, my mom was diagnosed to have an asthma and she always had a severe attacks of asthma.
Okay, and what about heart disease?
I don't remember, but my father was known to have a very high blood pressure, but he doesn't have any heart problems.
Okay, and anyone with diabetes?
Yeah, my dad.
Any cancer?
No.
Okay, so aside from those that you've mentioned, is there any other disease that has ever affected your family?
I don't remember any.
Okay, and now I'd like a little bit information about your social background, if that's okay with you, and if you don't mind me asking, what is your occupation?
Well, I am an entrepreneur and I usually work at home.
Okay, and then are you happy with your work?
Yes, I am.
Alright, and have you lately been exposed to people with fever, cough, or runny nose?
Well, a week ago my husband had a cough and he recovered already.
Okay, and at home is everything alright? No stressors at all?
None so far.
Okay, and how about your friends? How frequently do you meet them?
Before the pandemic, we always get together once a month. But since the pandemic is still here, we don't do it anymore. But we still connect with each other through social media.
Okay, that's good to know. And can I ask you, do you smoke at all?
Yeah, I consume at least 5 sticks of cigarettes a day.
Okay, and do you consider quitting smoking?
Yeah, I consider to stop it since it's bad for my health.
So that's nice to hear, and if you ever decide to quit smoking or stop it, you can come by here at our hospital and we have a team designated to help you and assist you in that process.
Okay.
Okay, so let's continue. Do you drink alcohol?
I don't drink alcohol, but I drink wine once in a while.
And your diet, what kind of food do you usually eat?
Well, I usually eat vegetables and also I like mixing it with some pork and some like chicken also.
Okay, and do you exercise?
I can't really exercise right now because lately I've been very busy.
Okay, well, I highly encourage you to do some exercise because it can help you improve your immunity and also incorporate some fruits in your diet.
Okay.
Okay, so we're done with those important data. Now I'd like to sum up everything that I've covered, and if I get any error, feel free to correct me. So, you are Miss Leslie Templanza, 49 years old, and you came here in the hospital due to severe coughing, itchy sore throat, and has a slight pain at the center of the chest during coughing. There is a slight difficulty in swallowing solid foods, but not with liquids. Breathing can sometimes be difficult because of the frequent coughing. You're able to cough out, which is yellowish in color and is sticky. And to alleviate the situation, you took carbocysteine Solmix 500 milligrams 3 times a day for 2 days and some lozenges. You don't have any other illness, but you're allergic to nuts, shrimps, and dog, which is a pet you have at home. And your father was diagnosed with diabetes and high blood pressure, and your mom with asthma. Aside from those, there are no other disease that has affected your family. And that's it. Is there any other that you'd like to correct?
None, everything is correct.
Okay, so we're almost done. Thank you so much for your participation.